안녕하십니까. 온라인 서전의 김경원입니다.
Greetings. I'm Dr. Kim Kyung-won of Online Surgery. I'm honored to share my surgical clip with you today. This is the initial visit panoramic image of the patient. The patient is 37-year-old male patient. In number 24, the tooth was fractured. Root rest was observed. The patient's chief complaint was that after crown fracture, which occurred 2 months ago, the patient experienced intermittent pain. If you look at the panoramic image in number 24, along with dental caries, there is root caries. I'm going to show you this on the CT, but the buccal cortical bone was severely destroyed. The treatment plan: the patient did not have any special medical history. Oral care was provided. Number 24 was to be extracted. Immediate implant placement was planned because the patient had no buccal wall. As for internal socket graft, EOS will be used. This is CT image before surgery. As shown, fracture due to dental caries occurred. Buccal wall is mostly destroyed. If you look at the root, it is divergent, and when doing extraction, I am assuming root resection may be needed. Extraction was done, immediate implant placement was done, and within the socket graft, the bone graft should be done. In the surgical clip before surgery, the tooth is fractured on the palatal side. You can't really see it. The tooth was sectioned, so I divided the root rest into two. The position is slightly palatally positioned. You cannot really see it here, but buccal wall is mostly gone in this area. Rather than using allogenic bone, I decided to use EOS, a xenograft, which is resorbed more slowly. EOS particle was used recently. These days, I think it would have been better if I had used EOS collagen. This is immediate post-op image in number 24. Initially, the ISQ value was 55-25, so not ideal because implant was placed in the extraction socket. On the CT, the implant has been positioned appropriately with adjacent teeth. It is positioned palatally on the buccal side. Sufficient bone graft was done. Because the patient had no buccal wall, EOS particle was used. This is panoramic image. This is at initial visit and right after surgery. This is 4 months after. The ISQ value was 79 and 78, and loading was planned. ER-type prosthesis was delivered, and the patient is not experiencing any major symptoms. After prosthesis delivery, when I took a CT, internal socket graft was done using EOS, and therefore buccal wall is well maintained. Let's look at the surgical clip. In order to remove the root rest, in my case, I use number 9 mold elevator frequently. The edge is sharp, therefore root rest can be removed. Because caries was severe, intentionally I did not cut the root. The palatal and buccal root are separated. The roots have been separated and been removed. Curettage has been done because immediate implant placement will be done. Granulation tissue needs to be fully removed. You can see that there's very little buccal wall and exposure can be observed. When you do immediate implant placement, if you place the implant more palatally, it'll be better. Lance drill is used. And within the extraction socket, I'm positioning it towards the palatal side. Side cut drill is used. I'm pushing it slightly distally. Because it is extraction socket, this is how it is positioned. 2.2 twist drill is used for drilling. Because it's extraction socket, the bone is not sufficient. Parallel pin is placed to check the position. The position between number 3 and 5, it's okay. Depth gauge is used to check the palatal bone once again. 3.5 by 10 mm 1 to 2 taper drill is used for drilling. 4.0 by 10 mm 1 to 2 taper drill is used. .5 by 10 mm implant will be placed. The final drill will be used only up to 4.0 because it's a extraction socket. The stability seems to be okay, but because it is extraction socket and there's no bone on the buccal side, the primary stability is not favorable. The stability is about 30 Newton centimeter, but if you measure the ISQ value, because there's no buccal bone, the ISQ value was quite low. In the post-op panoramic image, it looked as if it's close to the canine, but actually the position is okay. Smart peg was connected to measure the ISQ value. 55 and 25, because there's no bone on the buccal side, the value is quite small. Cover screw is connected. On the buccal side, in the area where bone defect is, EOS is used for bone graft. EOS was used for graft. Oscide was used. Collagen membrane was used for coverage and suturing was done. Hidden excess suture is used. Unlike figure of 8 suture, it goes from mesial to distal side. The collagen membrane is exposed, but in general, it heals nicely without major problems. In the past, when I used open membrane technique, at times I used a dense PTFE membrane, but in my case, the tissue response was not good for dense PTFE membrane, so I used collagen membrane. As of late, when I use EOS collagen in these cases, even without collagen membrane, tissue response can be better and the exposed area can heal better. These days, I would use EOS collagen for this case. Thank you for watching my video.